I wonder what's in my IV drip.
Good morning, Sam. How are you feeling?
I'm okay, but I was wondering what's in my IV drip. Do you know anything about that?
That's great that you're feeling better. For what's in the IV, I can certainly tell you more about it. Everyone naturally has sodium, chloride, and water in their bodies. Loss of blood and water, such as what happens during surgery, however, causes an imbalance in fluids, which can be fixed with an IV solution.
That's so interesting. Are there different types of solutions?
Yes, there are 3 different categories of solutions: isotonic, hypertonic, and hypotonic, with the basic one, a saline solution, being isotonic. Isotonic means having the same ratio of solute to solvent that is found in blood. Saline solution is made of NaCl, which is 0.9% sodium chloride and water. This is close to the concentration of salt in our blood. Glucose is added to the solution so the concentration is kept at a safe level and contamination is prevented. It's also to allow a patient's body to have the correct amount of
What are hypertonic and hypotonic solutions used for?
Well, hypertonic and hypotonic solutions are used in medical therapy. Hypertonic solution means having a high percentage of salt in a fluid, which takes out water and cells of someone's body. The solution fills blood vessels and sends sugar into a patient's body. This can treat diabetics and hyponatremia, which is when the sodium level is too low in a person's body. Hypotonic solution is when there's a low percentage of salt in a fluid, which brings in water into cells of someone's body, causing cells to grow in size. This is used to hydrate a patient. Colloid solutions increase the level of blood in a patient and are used because they stay in blood vessels. A person's donated blood can be mixed with saline to treat a low pH level in blood. This is called an intravenous solution, bicarbonate solution. Lactated ringers is another solution made with potassium, calcium, and lactate ions. It's used when a patient's blood volume must be quickly increased. Another example of solution is D5W, which has 5% of dextrose, a form of sugar, in water.
Wow, that's a lot of information on what's in my IV bag. Thanks for explaining.
No problem. The doctor will see you soon.
Hello, Sam. How are you feeling?
Hi, Dr. Robinson. I'm feeling much better. Thank you.
I'm here to discuss your upcoming CT scan and other radiology tests related to you. I'll give you a fair warning, it's going to be boring.
Okay, sounds good.
Okay, everyone must take an oral barium sulfate solution before getting the scan. It outlines your bowels and the stomach region. Since yours is with contrast, you'll need to have an IV to pump the solution in. Iodine is put in the IV so it brightens abnormalities found in your body. If a patient has kidney stones, then the IV contrast can't be used because it drowns out their appearance in the radiography. But we don't think that's what's wrong with you. To monitor blood flow to certain organs, we can use the process Sestamabi, which can be performed with the solution technetium. Technetium is injected intravenously.
That's interesting. Can you tell me more about the other tests you do?
Well, one is the MRI. MRI stands for magnetic resonance imaging, and gadolinium solution is put in IV to highlight the organs. All contrasts must have a magnetic resonance to show up on the radiograph. There's also a fluoroscopic exam, which is an active X-ray that uses the same barium solution for a CT scan to outline the esophagus to see things that aren't normally seen in an X-ray. Bone scans require technetium solution, which helps look for bone cancer. A PET scan or positron emission tomograph is where nuclear medicine or radioactive substances are pumped into a patient. The IV is constantly running because of the short half-life of the substance.
Whoa. Is that PET scan safe?
It is if the procedure is done correctly with precautions.
Oh, okay. I'm also curious about my surgery and just other surgeries in general. Tell me more.
That's great that you want to know more about surgeries. Since yours was an emergency case, we need to perform a blood transfusion. An emergency blood transfusion requires blood screening to make sure it's compatible and that the antibodies in the patient's blood won't reject the new blood, so you were perfectly safe. Your white blood cells would have attacked the new blood if a rejection occurred, but luckily it's very rare and didn't happen to you.
I'm glad my body didn't reject the blood. What about the use of antiseptics?
Antiseptics are used to prep the area so it's sterile before the operation. It's also used after anesthesia kicks in. Chlorhexidine is a type of antiseptic and it's soapy and it's generally more safe than others. Another is DuraPrep, which is alcohol-based, making it flammable until dry, and it's the cause of most of the surgical fires. It's still the most popular antiseptic used because it's the most effective.
Jeez, Duraprep sounds unsafe to me.
Well, that's what I used on you, so congrats on not catching on fire.
Well, thank you. I've trained very long and hard for this moment. But what is saline submersion? I heard someone talking about it earlier.
Saline submersion is used to check for holes and if hernias were tied off properly in the bowels. This is done by submerging the area in question in saline and pumping air through the body. Then the surgeon looks for bubbles. We had to use this on you because your abdomen was impaled during your crash.
Oh yeah, it was impaled by my cell phone.
Don't text and drive, kids.
Okay. I have a couple questions. How is anesthesia used?
Anesthesia is given on a weight ratio of milligrams of anesthesia per kilogram of person's weight. The anesthesiologist works mostly independently from the surgeon during the surgery, but they consult together before the operation. The anesthesiologist monitors dosage and the breathing tube and the vitals. Propofol is commonly used anesthesia. After surgery, we inject local anesthesia around the incisions to prevent pain. The surgeon uses things like in the Novocaine family, such as the lidocaine, but that only lasts for an hour. Bupivacaine, it lasts up to 46 hours, and it's more commonly used. That's what I used on me.
Oh.
General anesthesia is an emetic, which is a substance that causes vomiting and nausea. Because of this, after surgery, anti-nausea and pain meds, such as narcotics and opioids, are pumped in through IVs for the initial day or two. To dress the incisions, a clear dressing like a high-class liquid Band-Aid is used on dissolving incisions. Blood thinners can be given to a patient to prevent blood clots moving to the lungs, which are called pulmonary embolisms. This is especially helpful for bariatric patients, which are obese people. To prevent pulmonary embolisms, getting up and walking around is not recommended.
Gee whiz, the more you know.
Okay, bye Sam, I'm done for today.
Time to rest, Sam. I'll be back with your medication. Oh, I don't know why she asks all those questions. It must be the pain meds.
Lower her dosage.
No.
Let me tell you more about
That's not my line!
One go.
Since yours
Sam!
This is done by Sam.
No. No.